Hello, everyone. My name is Dr. Mark Costas, and I would like to introduce you to Dr. Dan Brisky and Dr. Taher Doon, and we are with the Coloraod Surgical Institute. We wanted to introduce you guys to a brand new year-long course that we are calling the Postgraduate Clinical Accelerator. Now, we all know, having gone through dental school, that we get barely enough clinical experience not to hurt somebody when we get out. And sometimes we get just enough to hurt somebody when we get out. And even if we have gone through a formal AEGD or a GPR, many times we don't feel confident in many of the just basic general dental procedures. This curriculum is designed in order to get you more experience and more advanced training, specifically in some of the general dental procedures that we think are really important to become a well-rounded clinician. So we wanted to take a moment to show you exactly what we're going to be covering during this year-long process.
Yeah, so on session one, basically what we're going to cover is fillings. We're going to do MODs, MODBLs, MODBL, WTF fillings. We're going to teach you how to get good isolation. If you can isolate a tooth, you can fill it properly. Because at the end of the day, you know, I've tracked my cases over years now. I've been doing this for pretty much close to a decade. And the cases where I didn't have good isolation, these things don't last a long time. Secondarily, you know, profound pain reduction for the patients, getting anesthesia in a way where the patients are going to be comfortable the whole time, for them to look at you and say, hey, doc, like that was the best, injection I ever got. I didn't feel it. That's a practice builder in itself.
I can't think of a bigger practice builder for myself. Going on my 20th year in general dental practice now was and is the ability to get a patient very, very numb and comfortably. I had a mentor that pulled me aside early on in my career, actually when I was still in dental school, and he showed me how to give profound local anesthesia and to do it pain-free. I've been able to use that technique and those types of techniques throughout my entire career. The word gets out really, really fast in each of the communities that I've worked in and amongst the patient base. So we will show you guys how to do those sorts of techniques.
Yeah, also we're going to cover the treatment planning, but it's going to be simple treatment plans all the way up to like the $50,000 cases. There's a transition point that occurs when you're selling a case over $10,000 where you're going to have to be able to analyze the patient, analyze the situation, present it in a way that kind of plays to that personality and that characteristic of the patient. And then you're going to have to be confident about it. Well, how do you get confident before you've actually sold one of these cases? So you're going to come in, you're going to do live repetitions with patients we've already treatment planned. Then you'll treatment plan it, present it, and then we'll just compare notes. We'll give you pointers. We'll record your treatment plans. You'll have a lot of information on how to get better in a short period of time on closing these larger cases.
Yeah, we're going to be talking about fixed prosthetics, removable prosthetics as well. A lot of the things that we're covering in this first session, we think that are very basic in order for people to get up to speed and quickly in a dental practice, to become a producer, but to do the productive procedures correctly and efficiently. Next, of course, is the one that stumps so many people, and it's probably one of the number one practice builders, and that is doing proficient, efficient root canals.
Yeah.
Right?
It's everybody's favorite procedure, right? Your assistants love doing root canals. You love doing root canals. But at the end of the day, it is by far one of the most important things you can do because yes, we want to talk about exodontia, bone grafting, implants. But if you got a shot to save a tooth, I mean, the root canal is the first way to go. And then on top of that, this is how you build your practice on emergency cases that come in. You build that portfolio of patients. You get them out of pain. You get someone out of pain, they're in your corner for the rest of your career. So we'll teach you how to do it quickly. We'll teach you how to do the buildup and crown. Keep in mind, you're going to do this on all live patients. So you're going to come see the patients we pre-treatment plan for you, do all the cases on live patients, and then we're going to track, because they're all patients of the practice, we're going to manage them for you after the fact. You're going to track the success of your work because it's not like going to a third world country and not even knowing if you did a good job. We're going to get you data on how you did.
Yeah. So if you guys would notice, session one really is about becoming a better restorative dentist, learning how to effectively diagnose and treatment plan, learning how to give profound and comfortable local anesthesia. So that's session 1. Session 2, strictly about root canals, because we believe it's the number 1 or number 2 most referred out procedure, and probably one of the best practice builders, especially as a newer doc. So that's sessions 1 and session 2. Dr. Brisky is going to talk about sessions 3 and session 4.
So going through dental school, we're all taught to refer. We refer surgical extraction, we refer bone grafting, right? Typically, we refer our bone grafting to the AEGD or the GPR that's associated with the program, or to the oral surgeons that are there as well. But we don't get proficient at it, right? One of the most profitable things for myself, Dr. Dune, Dr. Mark Costas as well, is taking teeth out, right? It also, you can develop your same day or an emergency visit. So I used to live on same day treatment, right? You're right out of school, you got to build your new patients, and what the best way to do that is to get a patient out of pain, right? So take their tooth out, then you become proficient at taking their tooth out. After you take your tooth out, well, what do you do with the hole, the giant hole that's there? Well, most of us are not okay with the 30% amount of bone loss that happens because we're not grafting things. So we're going to teach you some simplified approaches to simple and complex bone grafting, because the evolution is surgical extractions, bone grafting, right? Most of us eventually want to place implants. So going through this entire portion where we take teeth out, we graft, we eventually show you how to do vertical sinus lifts as well to really become proficient. All right, session 4, wisdom teeth. Wisdom teeth is my favorite procedure. I also find it the most profitable and easiest one now. When we first came out of school, it was very scary, right? How in the world am I going to take out a tooth that's covered in bone, right? Well, we're going to teach you how to take these teeth out in a very simplified approach to it.
So that concludes our summary of this brand new curriculum that we're putting together. Listen, guys, we understand that there are certain things that we were not taught in dental school, and we're expected to go out there into the real world and pick up these skills. Sometimes if we don't end up with a great work opportunity or a great mentor, it could take years and even decades, if ever, to pick up this skill set. So in a short period of time, in just 1 year, you can get this accelerated knowledge in one place with hands-on treatment on real patients. It's going to change your practice forever. So we hope to see you for this program at the Coloraod Surgical Institute. Check the link below to find out more and to sign up right away. Take care.